Hello, I'm Dr. James Allen Hurd, and I want to tell you something about muscle metabolism and insulin sensitivity. This figure shows how we use energy to get work done. We're warm-blooded creatures, using part of the energy we take in just to keep warm. We actually consume about twice as much energy as what we need for all the work to be done. Most of the energy goes to maintain and operate tissues and organs at rest. Also, it takes work to extract energy from the food that we eat and deliver it to where we need it. We operate a nervous system, we make hormones, and we do mechanical work like beating of the heart, as well as moving us around and doing things. We store a little, and we keep warm. The energy that's not used gets turned into carbon dioxide, heat, water, and waste. We have great flexibility in using the energy we take in. There's a natural range of almost 100%. Some people need only half as much as everybody else, and some use about that much more. Usually we use about 80 calories per hour. If we consume more than we need or less, our metabolism simply adjusts, all with the same body build and doing the same amount of work. Calorie restriction leads to increased energy efficiency. It decreases insulin sensitivity. Body weight stays constant, and blood sugar actually increases. Body temperature drops and heart rate slows, but all the organ and tissue work gets done using less energy. As a result, it's quite possible for body weight, metabolic rate, insulin resistance to stay constant at a lower level of calorie intake. Reversal of diabetes requires either further reduction in calorie intake, below 50% reduction, or a substantial increase in energy used. The most effective way to increase the amount of energy used is to increase muscular work. Just resting, muscles use about 20% of the energy consumed. That amounts to about 20 calories an hour. An extra 10 pounds of muscle would add about 50 calories a day. Not very much consumed by muscle that's just resting. Hard at work, muscle uses as much as 40 times the resting amount. That can be as much as 800 calories per hour. However, you have to work pretty hard to burn more than 500 calories a day. But exercising muscle not only burns calories, it gets ready for more. It not only replaces the energy it just used, it stores more. It increases insulin sensitivity. It starts clearing sugar and fat from the blood. It uses to replace the energy, and it builds stores of glycogen and triglycerides. Working muscle also directs the nervous system to stimulate the heart and increase circulation. The heart speeds up, it pumps blood to circulate oxygen and take away carbon dioxide to the lungs and deliver heat to the skin. Regular exercise sets everything on alert. Everything revs up and uses more calories. The harder muscle works, the more it uses energy to build more fibers, and the more it stores energy to work to come. Regular strength training also takes sugar, protein, and fat from the blood to build new cells. Resistance strength training reverses insulin resistance more than endurance aerobic exercise. The most efficient way to reverse insulin resistance is to work big muscle groups as hard as possible for 30 minutes every other day. This schedule increases muscle strength about 10% every month. It also decreases insulin resistance by 10% every month. The special advantage of resistance strength training is it restores insulin sensitivity as well as increasing muscle metabolism. Aerobic endurance training increases the energy deficit of calorie restriction and has little effect on insulin resistance if the body weight doesn't decrease. Resistance training is effective reducing insulin resistance even without reducing body weight. Our metabolism adapts to underfeeding by increasing its efficiency. All the work still gets done using whatever energy is coming in. Doesn't take any energy stored in fat. The insulin resistance stays high. Blood levels of sugar and fat actually rise. Body weight stays on a plateau, even when calories are reduced still further. The fasting blood glucose stays high. People say, I'm following the diet, but I'm not losing weight. My diabetes is getting worse. Aerobic exercise is not helping. Resistance strength training changes all that. It takes the energy it needs and gets ready for more work by increasing insulin sensitivity. Sugar and fat get cleared from the blood into muscles and liver. Fat gets released from stores and body weight starts falling. It takes time and effort, but increasing muscle strength does reverse diabetes more than calorie restriction and aerobic endurance exercise.